So today's question is, can you explain the difference between generalized anxiety disorder and social anxiety disorder? I mean, they sound the same, don't they? They're not, but both are recognized mental health conditions that are in the DSM, and both are characterized by persistent feelings of anxiety. So sufferers with both conditions also tend to always expect the worst case scenario. And with both conditions, people often experience physical symptoms that are associated with anxiety disorders. Things like muscle tension or headaches or fatigue. Now, in some cases, both conditions can also occur together, which of course increases a person's likelihood to experience depression alongside the anxiety. But despite the similarities, GAD and SAD do in fact differ in terms of the thought content that is produced by sufferers. Now, sufferers with GAD tend to worry about major life issues such as their health or their safety or their finances or the state of their relationships, for example. Their thoughts tend to focus on the fear of failure. So, an example would be a parent with GAD, and they may constantly worry about whether they've made the right school choice for their child. Sufferers with SAD, on the other hand, tend to worry more about everyday experiences. They'll worry about things like meeting new people, or being observed, or being judged, or evaluated. They'll have anxiety about speaking up in a group setting, in a work environment, or performing or speaking in front of people. So their thoughts tend to focus more on fear of rejection and humiliation. So GAD is anxiety about the big picture, and SAD is anxiety about the here and now. GAD sufferers often tend to be unable to pinpoint their exact source of their anxiety at any given time, while the anxiousness that is associated with SAD tends to be very intrinsically linked to an immediate social situation, like going for drinks or attending a meeting and having to give a presentation. This would be hell for somebody with SAD. Furthermore, the average age between the two is different. So the average age of onset for GAD tends to be early 30s, whereas SAD very often starts to manifest itself during the teenage years. As far as treatment is concerned, the treatment for the two do largely overlap. Cognitive behavioral therapy and anxiety medication, such as antidepressants, being the most effective treatments for both conditions. Now, I suppose it's important because social anxiety disorder is shortened to SAD, but also in the media you'll see SAD as seasonal affective disorder, which of course is something entirely different. So it's important not to get them both mixed up. Seasonal affective disorder is depression when the seasons change. So that's the difference between the two. General anxiety disorder is more about big picture things, and social anxiety disorder is more about the here and now and what we're experiencing in the moment. Right, so don't forget to follow my new YouTube channel. I want to build up the following there before I start posting longer, longer content videos in January. So the link is in the bio. So go over and follow me there, please. I mean, all you're going to find there right now is the videos you watch on TikTok, but in January we'll start posting longer form videos for YouTube.